Hey, this is Rusty, and we're going to talk through a rapid trauma assessment. Our scene survey is complete, our primary assessment is finished, and we have determined that this is a priority trauma patient. Load and go. But we still need to complete a rapid trauma assessment. We have C-spine control, and we pass it off to my partner, and then I sweep the head. Looking for bleeding, bumps, and depressions. I palpate the C-spine, C2 through C7 for step-offs or deviation. I inspect the front of the neck for JVD and trachea midline at the sternal notch. I'll IAP the chest. I'll inspect for decap BTLS. I will auscultate right lung sound, left lung sound, and heart tones at the PMI. And then I will palpate down on the sternum, in on the sides, looking for grimace and listening for crepitus of broken ribs. Then I'll do a gross palpation of the abdomens for guarding of abdominal muscles and grimace on my patient's face. Then I'll go down on the iliac crest and in on the sides, listening for crepitus and looking for grimace on my patient's face. I'll sweep for a priapism and I'll palpate for moral pulses. Once I palpate for moral pulses, I'll inspect the thighs and lower legs for crepitus and grimace of my patient's face. I'll do a pulse of the posterior tibial pulse or the dorsalis pedis for pulse. Can you wiggle? Motor. Can you feel me touching you? Sensory. PMS. And a cap refill. Then the other leg, thigh, lower leg, crepitus and grimace, posterior tibial pulse or dorsalis pedis. Can you wiggle? Can you feel? Pulse, motor, and sensory, and a cap refill. I'll do the same thing of the upper extremities. Upper arm, crepitus and grimace. Lower arm, crepitus and grimace. Radial pulse, can you wiggle, can you feel, and do a cap refill. Upper arm, crepitus grimace. Forearm, crepitus grimace. Radial pulse, can you wiggle, can you feel, pulse, motor, sensory. Then it's time to log roll our patient. On our C-spines count, we're going to log roll up. Remember, the C-collar is in place. On 3, 1, 2, 3, we will sweep the back of the head. We will inspect the back and palpate long spine, thoracic, lumbar, all the way to the top of the buttocks, and then we're going to look at the butt for bright red bleeding from the rectum. If it's bright red, it's arterial. If it's from the rectum, they need surgery. So no BRBR. Then on the head person's count, we will log roll onto the backboard. 1, 2, 3. We got them on the backboard. Once we get them on the backboard, we're going to do the baseline set of vital signs. Pulse, respirations, and blood pressure. We're going to do that while everybody else straps them in, because if you've been in EMS for more than a minute, you know that from the backboard to the ambulance may be several minutes. So you should get your baseline now. And that's a talk through of a rapid trauma assessment.